Hello, my name is Imaya, and today I'm going to be talking about what Asperger's is. The goal of this speech is for you to be able to define Asperger's, know its treatment options, and know what life with Asperger's would be like. Asperger's is a neurodevelopmental disorder characterized by repetitive behaviors and social awkwardness. There are many effects of Asperger's, one of which is its complex speech pattern. Now, people with Asperger's have a formal tone. They talk to their friends the same way they talk to a teacher or parent. They also have less expression in what they say. For example, words like happiness, sadness, anger, and confusion would have a smaller effect because of how it's said. It's almost like they're speaking like a robot. People with Asperger's also do not use slang. People with Asperger's don't understand the point in cutting off words from sentences or even letters from words just to make a certain sentence or statement. They find it highly annoying and don't understand it. Or if they do understand it, ignore it completely because it's not right. People with Asperger's also have an awkward social interaction. They misunderstand some terms and sometimes react in the wrong way. People with Asperger's also misunderstand social cues. For example, a person might be leaning their elbow on the table and placing their hand somewhere on their face, and a person with Asperger's wouldn't understand this action and continue with whatever action he's doing, despite the fact that the signal means that they're uninterested. People with Asperger's also find it very difficult to change quickly in different situations. For example, playing tag in the park and someone decides that you can no longer touch the ground. People with Asperger's find it highly annoying and decide to either ignore this change or quit because of this newfound change. Another example is in my life when we were going to the same doctor's room for the month, and then the doctor decided to change the room. Now the other room was open, but I just couldn't understand why the change. People with Asperger's also have one more effect, and this is the most commonly known effect, and this is their increased intelligence. Now, people with Asperger's can retain information better than some other people can. For example, they might learn the concept of multiplication is just adding up groups of numbers until they get to their end result. And people with Asperger's also learn information faster than other people. For example, they might learn math, science, or social studies faster than other people could. They also have a general subject that they're good in. For example, mine is health and sciences. I frequently give out information that other people would see as pointless, yet I feel that it should be common knowledge. There are also many treatment options for Asperger's, one of which is medication. Now, the medication class I'm going to be talking about is SSRI, or selective serotonin reuptake inhibitor. Now, medications in this class are such as Risperdal. Now, Risperdal is used to lower obsessive behaviors. For example, the habit of biting your nails all the time or organizing everything before you use it. Then there are also two other medications known as oxytocin and vasopressin. Now, these two medications act as one medication when they're put together. Oxytocin is used to help people understand social cues, such as the one earlier, leaning your elbow on an object and pressing your hand on your face as a sign of not wanting to listen to whatever is being done. And vasopressin is used to lower social anxiety. So when these two medications are taken together, it increases socialness. And there's also therapy. And two therapies that I'm going to be talking about is applied behavior analysis and group psychotherapy. Now, applied behavior analysis is when a psychologist comes in and helps a person with Asperger's understand social cues and teach them how to react efficiently in social interactions. For example, meeting a new person. And group psychotherapy is when a group of psychologists and other people come in and they all learn how to react socially and learn social cues. Now, this is more effective because there are all constantly new people coming in and out of the group. Now, this can last for years to decades, but the longer this is done, the better the symptoms of Asperger's get. Finally, I'm going to be talking about what life with Asperger's would be like. I would know because I myself have Asperger's. Now, life with Asperger's is very difficult because of constant changes in the world and how things work. For example, earlier with the explanation of tag, there's another example with how life changes. And this is how people are constantly and seriously, constantly changing what should be done and how it should be done. For example, say someone decides to play Marco Polo and they decide to take all of the finding out of it. No more blindfold, it's more like hide and seek. Now, a person with Asperger's would just note it as hide and seek because of how it's being played, but other people might argue it as being Marco Polo. And this annoys a person with Asperger's because, once again, they're changing the rules to something they already commonly know. Another reason that it makes it hard for people with Asperger's or me to get along with other people is meeting new people. Now, because of their formal tone, people with Asperger's or me, myself, find it harder to communicate with others and explain themselves and their actions. Now, meeting other people can be easier than it is to explain your actions because people with Asperger's can't explain themselves efficiently. They can't find the right wording to explain how they feel or what they're doing. And this is one of the common problems in life for people with Asperger's. In conclusion, you should know what Asperger's is, a neurodevelopmental disorder, its treatment options, medication and therapy, and the effects of Asperger's, like complex speech, social interaction, and increased intelligence. Thank you for listening to this speech.